Welcome to Education Lounge.
Have you ever actually stopped to wonder what makes you, well, exactly you? It's wild to think about, right? Human personality is just this incredibly intricate landscape. It's a complex, tangled web of our thoughts, our emotions, our behaviors, and all those hidden motivations we don't even realize we have. Today, we're going to unpack the really dynamic challenge of evaluating personality, and we'll explore the genuinely fascinating methods psychologists use to unlock the mind. Okay, let's dive into this. When psychologists sit down at a desk to try and understand our individual differences, they aren't just taking wild guesses. They actually organize a very specific toolkit. And this foundational toolkit is built on a whole variety of evaluation methods. We're talking everything from rigorous, highly structured questionnaires to these deeply intuitive techniques that can literally reveal our unconscious processes. But honestly, this brings us to a pretty massive question. How on earth can we possibly quantify something as complex, shifting, and deeply personal as human personality? I mean, it is the ultimate puzzle. And to solve it, experts have developed these distinct lenses through which to view human behavior. You can think of each lens as offering a totally unique piece of the puzzle. So, here is our roadmap for today. Number 1, the trait approach. Number 2, the holistic approach. Number 3, we'll take a deep dive into projective techniques. 4, we'll examine standardized tests and, their limitations. And finally, number 5, a quick method summary to see how the whole shebang fits together. All right, tool number 1, the trait approach. Let's look through the analytical lens. The core principle of the trait approach is actually pretty straightforward, but it's super powerful. Basically, it focuses on identifying the stable traits that consistently define you over time. So if you've ever taken one of those tests that scores your extroversion, or say your conscientiousness, you've used a self-report inventory. The most famous one out there is the Big Five, which breaks your personality down into the acronym OCEAN: openness, conscientiousness, extroversion, agreeableness, and neuroticism. But, there's a flaw here. Relying purely on traits is kind of like trying to understand an entire movie by only looking at a few still frames. It can really oversimplify our dynamic complexity, and it completely overlooks the unique situations and contexts we find ourselves in day to day. Which brings us to tool number 2, the holistic approach, taking the wide angle. Because those traits have limits, psychologists sometimes need to zoom out, right? That's the holistic approach. The core philosophy here is evaluating the whole person. So instead of just checking little boxes on a clipboard and breaking you down into isolated pieces, it's about seeing how your thoughts, your emotions, and your environment all dance together into one cohesive understanding of who you are. To actually get this wide-angle view, psychologists lean heavily on in-depth interviews. These aren't just casual chats. They are profound, detailed discussions about a person's life experiences. It lets the evaluator hear the person's unique story in their very own words. However, because it is a fluid conversation, it does carry a very real risk of interviewer bias. That's where the evaluator's own background, or frankly, even just their mood that day, might unintentionally color how they interpret your story. Now, another really vital tool in this holistic approach is the comprehensive case study. This involves building a deep understanding of a personality by putting together an extensive biography of the individual's life. And while these are incredibly rich in detail, case studies are, as you might guess, super time-consuming. Plus, they're highly subjective and extremely difficult to standardize across different people. Moving on to tool number 3, projective techniques. This is the deep dive. Now, what's really interesting about this slide is how it pivots from the conscious mind to the unconscious. We use projective techniques for this. The theory here is just fascinating. By presenting you with ambiguous stimuli, these techniques effectively bypass your mental defenses. The most iconic one? For sure, it's the Rorschach method, developed way back in 1921. Take a quick look at these symmetrical inkblots on the screen. What do you see? Is it a bat? Maybe 2 faces? The cool thing is, there is literally no right or wrong answer. By analyzing the content, the location, and the patterns of your response, clinicians can uncover hidden motivations, assess your thought processes, and evaluate your emotional functioning. Next up is the Thematic Apperception test, or the TAT for short. Here, you're shown ambiguous pictures depicting human figures in various situations, kind of like the one on screen right now, and you're asked to create a narrative about what's happening. And the stories you generate, they provide absolutely incredible clinical insights. See, it's the very act of creating that narrative that reveals your achievement motivation, your need for power, your desires for affiliation, and even deep unconscious conflicts. The themes that pop up across multiple cards reveal the really consistent patterns in your personality. Another brilliant semi-structured approach is the sentence completion test. You're given an incomplete sentence stem, something like, I feel happiest when, or my greatest fear is, and you're just asked to finish it spontaneously. Because it requires a quick gut reaction, these responses usually bypass your internal filters. They expose underlying feelings, emotional conflicts, and interpersonal schemas. It's a highly flexible technique, and it's incredibly valuable in both clinical and research settings. Finally, in this category, we have picture interpretation tests. Take a look at these ambiguous images. Do you see a skull there? Or is it two people sitting at a table? Do you see a face? Or maybe a tree? By describing these scenes, individuals actually project their own internal psychological states right onto the external images, which uncovers subconscious tendencies. But keep in mind, the challenges here are pretty significant. Interpretation is heavily subjective, the reliability can be a bit limited, and specific cultural factors can totally affect how an examiner understands your response. All right, on to tool number 4, standardized tests. And of course, the catch. All this ambiguity we just looked at, it naturally leads us to seek out more objective data, and we get that through standardized tests and inventories. Think of heavy, questionnaire-based assessments that yield hard, quantifiable data. Because they're normed and tested against massive populations, they provide a very structured, rigid baseline that we can compare an individual's results against. So the crucial point is really understanding which test does what. Let's break down the alphabet soup here. First is the MMPI, the Minnesota Multifaceted Personality Inventory. It is the most widely used clinical assessment out there, using a staggering 567 true or false items to identify psychological disorders. I mean, can you imagine sitting through all of that? Then there's the famous MBTI, the Myers-Briggs Type Indicator. You've probably heard of this one. It's based on Jungian theory and sorts you into one of 16 personality types across dimensions like extroversion and introversion. And finally, the CPI, the California Psychological Inventory, which measures everyday, normal personality traits relevant to social interaction, things like sociability and responsibility. But, as I mentioned, here is the catch. These structured tests face 3 major challenges. First, they are extremely vulnerable to socially desirable responses. Second, they often completely miss those deep, unconscious aspects of personality that the projective tests we just talked about capture so well. And third, they really struggle with cultural factors. Tests developed in one specific cultural context often just do not generalize perfectly across diverse populations. Let's look a little closer at that first major risk, social desirability bias. Look, when we sit down to take a self-report measure, respondents often answer in ways they perceive as socially acceptable, rather than completely truthfully. Let's be honest, we all want to look good on paper. Nobody wants to check the box that says, yes, I am highly argumentative and generally difficult to work with. But this totally natural urge to fake it severely compromises the test's validity and its diagnostic accuracy. Let's move to section 5 and see how this builds a complete picture in our method summary. So let's open up this complete toolkit and look at it all together. We can clearly see how each method serves a distinct, totally necessary purpose. The trait approach zeroes in on our consistent habits and traits. The holistic approach steps back and gives us the whole person life story. Projective techniques act as a sort of deep-sea submarine down to our subconscious elements. And those standardized tests, they provide the hard, quantifiable data we absolutely need for baseline comparisons. What this brilliantly illustrates is that no single method is perfect on its own. Actually, scratch that. No single method is even close to perfect on its own. The most accurate and comprehensive personality evaluation requires a really careful balance. Psychologists have to integrate these diverse tools. They have to weigh the objective data of standardized tests right alongside the rich subjective insights of holistic and projective methods if they truly want to understand an individual. So, as we've seen, measuring a human being is part science, part art, and it is deeply, deeply complex. So I want to leave you with this to think about. If you were sitting across from a psychologist today, which of these psychological tools do you honestly think would best capture the real you? Would it be the structured certainty of a standardized test or the ambiguous freedom of an Inkblot? Thank you so much for joining me on this explainer, and keep questioning what makes you you.